Right, I just wanted to thank you all for listening into the Suicide Prevention for Local Governments and Communities webinar, and once again apologise for having to postpone it from last week. There was a few technical difficulties. So my name is Alison. I'm from the Injury Control Council of Western Australia, and I will begin the webinar by providing you with a bit of an overview of suicide prevention in Western Australia before passing it over to Tracy McCown from Suicide Prevention Australia, who will discuss with you how local governments and communities can support the local community, planning tools that exist to help, as well as looking at the importance of collaborating with many different sectors in the local community. So if you have any questions, please send them through and we will save time at the end to answer them. So just first of all, before I start, I just wanted to give you a bit of a background information about the Injury Control Council and what we do. So the Injury Control Council of WA is a for-purpose, non-for-profit agency leading the way in preventing injury and supporting recovery in Western Australia. At ICWA, we believe injuries and violence don't just occur by chance. They can be predicted and prevented through a range of coordinated, evidence-informed programs and services. Our aspiration is that all West Australians, children and adults alike, can enjoy a life uninterrupted by injury. So at ICWA, we deliver 3 core programs: the road trauma support, which is a free counselling service for those affected by road trauma; Stay on Your Feet, a falls prevention program for older adults living in the community; and also No Injury, which is who will be delivering this webinar through. So the No Injury team provides knowledge and skills as well as networking and partnership opportunities, enabling practitioners to deliver evidence-informed activities. So just before I begin as well, I just wanted to take the time to say that suicide can be a sensitive subject to discuss. So if you, if yourself or someone you care about is in crisis and you think immediate action is needed, please call the emergency services, contact your doctor or mental health crisis service, or go to your local emergency hospital department. So loss of life to suicide is profoundly saddening, and suicide has ripple effects in the community. The economic and human cost of suicidal behaviour to individuals, families, communities and society makes suicide a serious public health concern. Every child has the right to grow up in a healthy family and safe community with opportunities to live a meaningful life, develop positive relationships and achieve goals. So the suicide rates in Western Australia are among the highest in the nation. In 2012, 366 people died by suicide, which equates to 1 person passing every day. Suicide results in an average loss of 34 years of life lost per person. This compares with an average years of life lost through deaths from heart disease, which is 4 years, and cancer, 8 years of life lost, which really puts things into perspective. So in Western Australia, the suicide rate has been considerably higher than the national average since 2016. As you can see from the graph, West Australia has remained steadily above the national average. The reasons for WA's high suicide rate is not yet really fully understood, and will actually be the subject of focused research during the implementation of the new state government suicide prevention strategy, Suicide Prevention 2020. So suicide rates for males are higher than those for females, which is consistent across every state and territory of Australia and also other Western countries. In Australia, men account for 3/4 of all suicide deaths. However, the suicide rate among women has also been increasing. Although men have higher rates of suicide, more women than men attempt self-harm. The highest age-specific rate for males in 2015 was observed in the 85+ age group. This rate was considerably higher than the age-specific suicide rate observed in all other age groups. Although this rate is unusually high, it only comprises a small proportion of total deaths in this age group, and suicide in this age group has not been studied as extensively, and suicide prevention efforts tend to focus most heavily on the groups considered to be most at risk, such as teens and young adults. So in Western Australia between 2008 and 2012, the three regions with the highest age standardised rates for hospitalisations for self-harm were the Kimberley at 206.5, the Goldfields 167.2 and the Wheatbelt at 146.5. Individuals living in remote and regional communities in Western Australia have a higher suicide rate than those living in the metropolitan area, with residents of very remote WA having a 40% increased risk of suicide. It has also been reported that April, November and January have higher rates of suicide during those months than the rest of the year. So looking at the suicide attempts in Australia, it is estimated that each year in Australia 370,000 people experience suicidal thoughts, 65,000 suicide attempts occur, and 35,000 people are admitted to hospital for suicide-related injuries. So for the Aboriginal and Torres Strait Islander community, accurate suicide statistics and population estimates can be difficult to obtain. The data on suicide levels and rates for this group are likely to be minimum figures. Suicide is more concentrated in the earlier adult years for Aboriginal and Torres Strait Islanders than for the general Australian population, with data available indicating the highest rates for both males and females in this 15 to 24-year-old age group. For Aboriginal children aged 14 years and less, suicide is the second leading cause of death, and they are 8 times more likely to die by suicide than their non-Aboriginal peers. For Aboriginal people 15 to 35 years, suicide is the leading cause of death. 30% of these deaths in this age group are reported as suicides. Therefore, not nearly 1% in this 20-year age group are suicides. So looking at the hidden toll of suicide, it is recognised that a number of suicides and attempted suicides is likely to go unreported for a number of reasons, including the practical problems of determining a person's intentions, reporting problems, and the stigma around suicide and self-harm. The tragic loss of life affects family, friends, colleagues and peers. So they say that for every death by suicide, there are 6 people experiencing intense grief, which may continue for many years. So I guess it all kind of looks pretty doom and gloom, but I think the most important thing to remember is that suicide is preventable. Suicide is a concern for all communities, and all levels of governments have a role to help in reducing suicides. So it's been shown that well-informed, community-led action backed by evidence-based programs are the cornerstone for effective suicide programs or activities. So I've provided a few links to websites where you can access further information or resources or research. So what I'll do now is I'll pass you over to Tracy from Suicide Prevention Australia, who will be able to discuss with you further how your community can get involved in suicide prevention.
Okay, hello everyone, and thank you very much for joining us today for this webinar, and a big thanks to Alison and the team for organizing today's webinar. And today we will discuss a little bit more around the practical options that would exist for councils and local communities, especially after just receiving the overview of the statistics. As far as who I am and who Suicide Prevention Australia is, I am the manager of what we call the Lived Experience Network, and this is a group of individuals that are based right around Australia who all identify as having a lived experience of suicide, and each of them have identified to us that they want to find a way to be involved because of their lived experience. They actually have a lot of wisdom and some knowledge, and we believe that they should be contributing to the programs, policies that get developed and delivered into communities. And so in that sense, we also have a speakers bureau that we train individuals to tell their story in a sense so that it helps contribute to the reduction of suicide. I'd also like to acknowledge all of those who've lost their life to suicide and the suffering that suicide brings when it does touch our lives, because we are all brought together by experience and are unified by hope. And Suicide Prevention Australia also acknowledges the traditional owners of country throughout Australia and their continuing connections to land, sea and community. We pay our respects to them and their cultures, both present and in the past. So Suicide Prevention Australia is a peak body of suicide here in Australia, and as such it means that we work with and collaboratively with different communities, organizations that work in this sector. One of those ways that we work collaboratively is we are the lead agent for the National Coalition for Suicide Prevention, which is where we build partnerships and facilitate the communications to bring change into the behaviors and attitudes towards suicide and suicide prevention, and to help amplify the voices of those with lived experience of suicide. So I'll just cover a few definitions, including what we're calling a lived experience of suicide. So it is a fairly inclusive and broad descriptor, and it is that anyone who has experienced suicidal thoughts, anyone who has attempted to take their own life, as well as anyone who has been a carer for someone. That might be someone who's attempted suicide, but also if that is an individual that is living with suicidal thoughts. It does include anyone who is bereaved by suicide, but we include a phrase of having been touched in some other way. And in this other way, and as you as a local council consider how you're going to work with your community, this is an important component you'll want to remember. This could include individuals such as first responders, the police, the fire department. It could also include individuals who work in the practice of, say, a psychologist or a counselor or other professionals that work with individuals, and it impacts how they feel about suicide and how they respond to it. And as we move forward in this, it's just important as we think about that community, because it's all of these. It is the bereaved. They have a lot to share with us, but it's also these individuals who've had suicidal thoughts and who've attempted but are now in a path to stay alive and living well, and we need to work with them to create new ways forward. Now, the dynamics of a community is actually really broad, because community is anything that is a social group, any size, whose members reside in a specific locality. So in your case, your local LGA perhaps, but then there's all the subgroups as well. These individuals will identify themselves because of anything considering, say, cultural or historical heritage, or social, religious, occupational, any other group that the group feel that they share common characteristics. So as a council begins to consider who will they work with, it will be important to gain a greater understanding of all of these dynamics of community, and they all need to be incorporated at some level into your prevention plans. Now, one of the terms that often gets used but not always is this social determinants. And on the Communities Matter website, which we will go to in a bit in our discussion, there is a document that can be downloaded that they use the term of risk factors. And again, as we look at what will we do with our community, these are the areas to keep in mind and how we can bring them into the actions and activities. So alcohol and drug abuse, work-related issues, so loss of a job, and as well as physical injuries on a job, bullying, long-term unemployment, and the emotional and psychological trauma that can create, physical, sexual, child abuse, bullying of children, relationship strains and breakdowns. So it's quite a diverse group of social determinants, and this is in addition to those who have a diagnosed mental illness, so that all of these can contribute to the reasons why a person may become less capable to rebound, their ability to move on and cope with life can be progressively reduced as numerous things build on top of each other. So there are plenty of planning tools available, so the Communities Matter one we will come to, but one of them is still important for all of you to get familiar with, and that is your own Government of West Australia's Mental Health Commission's suicide prevention strategy, so Suicide Prevention 2020. It is available online for download. If you've not been reviewing through that, it's really worth doing so. It's a progression to the last one. There are key 6 action areas that it touches on, and each of them actually really do relate to the tools that are available on Communities Matter, and that is around this general sense of creating a greater public awareness and bringing a united action, so a united voice across the community, and local support in the community, which really needs to come back to person-to-person support and less so around e-support, as there are numerous evidential bases that are saying that person-to-person is what really works for people. So when you get a chance, if you haven't already, be sure and access the Suicide Prevention 2020 plan, and that can be very much used in coordination with the Communities Matter website. So the Communities Matter website is a tool that was quite specifically developed because of individuals in communities who wanted to set something up but weren't quite sure how to start. It is now an online toolkit, and originally we worked with numerous individuals to create this, so including the Mental Health Commission of New South Wales, as well as a few other organisations who helped do some fundraising. And the current website is administered by the Hunter Institute of Mental Health, so our thanks to both the Hunter Institute of Mental Health and the work that we do with them, as well as the Mental Health Commission of New South Wales for working with us on this important initiative. So we received comments directly from small communities as saying that they needed to do something. There had been more than a comfortable number of persons who had died. It could have been one because it was a small community, or it was several in a row, or several over several years, but it was impacting that community. They also told us that they needed some guidance. They just didn't even know how to start. This was all quite new for them. So to that end, we began to start discussions with some of these very communities to see what we could develop that would give them the guidance they were after. So the Communities Matter website does include a range of information, including some templates, some examples from other communities, as well as just how to get started. So we'll start to look into each of those. So how it might start for your group, and we do recommend for a community that really wants to create some change to actually create a community action group. Some of these are called a Suicide Prevention Action Network. Others have quite diverse names. The intent here on a community action group is that it's a whole of community that we're bringing together to bring out a whole of community change, because suicide is very complex. There's no particular group that is excluded. There's no particular age group that it doesn't occur in, so it is an all-of-community event. So we need everybody on board to help bring about this change. So as far as starting a group and running a group, the website will also include a lot of information around who to bring in, who to be trained. There's some information around the media and things like that. And this is a space that a local council can really help get involved. Your local community members may not have some of the skills, some of the resources to actually do these types of these steps, especially when we talk about making sure you've got your leaders in your community involved and prepared to get engaged, as that can really help to bring in more people and to reduce people's fear of being involved in something like this. And again, we want to make sure that we include individuals, including all types of lived experience as you go through all of this. So every step along the way, who do you have, whose voice is involved, that can give you the perspective from a person who has already experienced some form of a suicide, whether that's a suicide attempt, they're bereaved, or they've lived with suicidal thoughts or others. And this begins to progress that sense of what we need to do to network. And again, all of these bullet points, these are all offered on the website with additional information, but that's not an overload of information. So we'd like to give you a little bit of inspiration and ideas that have come through from other groups. And there are a lot of groups out there that are using it. A few are sharing their information directly onto this website. So the first one that I'll mention is the Mount Gambier Suicide Prevention Network of South Australia. And I picked out the Mount Gambier one because one of their key factors was they do work with their local council. The local councils have gotten right behind the work that they're doing, and they've stepped in many of the ways that we've just covered in the previous slides around helping to bring the community together, give them the both verbal space and occasionally some financial support as well. And they've created some really good accessible documents. So from the Communities Matter website, you can download Mount Gambier's action plan for 2013-2016. And also just on the general website, it's also able to find their basically a report card for that same period, so you can actually see what are some of the successes they have had over this time, and they're beginning to look at what they're going to do moving forward. But all up, the community has found that working progressively and broadly within the community with the support of the local council has made a huge difference into the work that they're doing. One of the other ones is here in New South Wales is the Bega Valley Shire Council of New South Wales. And the Bega Valley Shire is a small community who very much have experienced a lot of persons who have died by suicide and decided to create this network. They were a group that have worked with their local council so that the local council provide them the resource of actually a space on their website, so that helps them to communicate with the broader community what's going on, and they also help promote the activities of the Bega Valley Span, as they call it. So again, this is another one that very much works closely with their local council. Often they have, I believe that they've actually got someone that is on the council and assigned to be the key person for the Suicide Prevention Action Network. Each year they host a World Suicide Prevention Day walk, and they also deliver various talks, and working with the council they're able to deliver suicide prevention training to that local community. So these are really key ways that a local council can get involved in the sense of helping bring through resources, whether that's human resources, online space resources, the capacity to help make training available to the community, particularly people such as the gatekeepers, but we also want to see a broader sense of community training that just breaks down those fears and behaviors that create barriers to people seeking support and help. So when you get to viewing a lot more time on the actual website, there are a couple of important spaces that can really help as you prepare to work and you end up talking to a lot of people. So there are these tips and tip sheets that exist here around helping myself and helping someone I know. And this includes things like learning around the myths and facts about suicide and the warning signs and where to go to get help. And of course, being able to immediately provide information to someone, as Alison did in the beginning of her PowerPoint, of what are the at least the national helplines to help someone get help is quite critically important. And it also provides additional links to other resources that are external to the Communities Matter website, which is called conversationsmatter.com.au, and at Conversations Matter it provides some tools about how to start a conversation and what to say and kind of what not to say. Now, when we talk about the do's and don'ts, there are a few things like that we would want to avoid when talking with someone. There's a fact sheet that you can download. It's a PDF document. But I wanted to jump to the myths and facts document that's available, because this is a space where if we can begin to really change how people think about suicide in the broader community, especially those who've not been impacted by suicide directly, we have a pretty good chance of beginning to open people's capacity to start conversations. And it seems like there is a myth that if we talk to someone about suicide, it might make them consider taking their own life, when in fact the evidence shows that if we ask someone about it directly, if we're concerned about their well-being, it actually opens the door for them to share with you. They're more willing to speak with you because they feel that you will listen. One of the other ones is that we should never promise someone that we will keep their plans of a suicide secret. It's a big thing to do if someone's telling you that they are suicidal. Keeping it a secret is not the way to go, and instead we need to help them reach for the support they need and do that with urgency and never assume that they're joking. So I would highly recommend everyone seek out the myths and facts about suicide on the Communities Matter website under the Help Someone menu item. It's a very valuable document, and get really used to it. And if there's questions around any of that, we'd be very happy to explore it further if it doesn't make sense, but I'm quite sure you'll find it helpful. On the suicide warning signs, these are the types of things that people can begin to consider watching for in their friends and their colleagues as people that they know well. But both of this document will help everyone realize just how complex suicide is and how difficult it can feel for people. So it's all about education and getting used to what are some of the things that we need to consider, and then learning how to ask the question of, are you actually feeling suicidal? And so when we talk about what a local council can do, if we can increase the knowledge, which is education, about the suicide warning signs and across the myths, we can begin to bring about the change and reduce the number of people who reach the point that they don't end up getting the help they need and in fact dying. So as we talk about some of the fact sheets and planning tools and templates that are available, there's one of the ones that would possibly be very helpful for someone like the local council to work with a local community, especially because you would have access to some of the details, would be on building a picture of your community, to understand your community as well as you can as to the culturally and linguistically diverse components of your community, major religious affiliations, the age breakdown of your community, the broader community, as well as those who are living within it, in the city versus the regional areas around it. It's good to understand all of these types of components as you build that picture, including education, levels of income, and if there's any groups that somehow don't get represented frequently, that would be including anything around the LGBTIQ groups, as well as our Aboriginal and our Torres Strait Islander groups. Ensure that they get included when you are building a picture of your community. So there's a Microsoft Word document that's available for download that can help you think about building the picture of the community, and if you can work with your local Action Network group to create that so that it's as complete as possible. There's also another Microsoft Word document that can be downloaded that's entitled Including the Whole of Community. And this is a tick box of different things that can be considered and very helpful again. So it's things like the cultural awareness within your community. Are there some links and consultation options with extended families and local groups that can be useful for creating this whole community concept? So considering appropriate protocols, services, whether or not there is activity that will be affirming of a participant's identity. So that again comes back to our individuals who are in what we would call a vulnerable group that often receive quite negative attitudes and behaviors toward them. We want to make sure that the activity that is undertaken in this community effort gets endorsed by community leaders, and that can also be a key point that a local council can help to really bring in community leaders because of your contacts. So again, encouraging everyone to look at the Communities Matter download section so that you can check out these templates and tools that are available to assist. So as it says on this slide, you can help them to secure the community leader support because you're going to have some strong contacts with community leaders. Be sure and consult and involve local people, both those who have a lived experience of suicide and a diverse group of persons with a lived experience of suicide, as well as an extended range of friends of those people. See how your local council can support local initiatives. This could be simply being able to assist a group as they want to host a memorial walk, giving them access to spaces for free if possible for training events and helping training events happen, helping with any cultural or language barriers that might exist, bringing in extra help around converting language if that's needed for your particular diverse community, and help them to be working collaboratively with their local services. Suicide prevention's key messages for communities is said that suicide is very complex. It has many different reasons for it to occur for different people, so every single story is different, but we do believe that suicide can mostly be prevented. And as individuals and as communities, we want to really start to pay a lot of attention to our family and our friends and our work colleagues, those people that we know quite well, who we begin to notice changes in their behaviors, their actions, if they're starting to withdraw, if they're starting to pick up habits that are not their norm, and connect with them and be honest and open with them and listen. Ask them the questions, you know, noticing, I see that you're not behaving the same way, I see you drinking more than, I see that you're not going out and doing the things that you used to do. And gaining the skills to actually ask the question, are you thinking about killing yourself? And then listen. And as a community, as a whole, education is what will help us to be able to give help, but also how to get help, both how to get help for someone else and how to get help for ourselves if we come into a point that we need that. So just in a conclusion, we know that there's a lot of strategies that a community can take. It can be increasing well-being and resilience, helping to create a stronger way for people to have a social connectedness across an entire community. There's strategies that help with our vulnerable people and the vulnerable groups in a community, work together to find those ways. And specifically, we know that anyone who has made an attempt to suicide is at high risk. And we also know that individuals who are bereaved in their early days of extreme bereavement have occasions to also become suicidal themselves. So we need to keep a close eye on our communities, our families, our friends, and our colleagues. And that wraps it up for me. I'm quite happy to answer any questions if any have come through. And thank you again for joining the webinar.